If nostalgia overtakes you, then it's justified. The boy's own man, Ronan Keating, with Life is a Roller Coaster. Last leg of conversation on our Heart to Heart World Heart Day, World Heart Week specials with Dr. V, Dr. Vishakha Shivdasani.
This is Good Morning Mumbai with Hrishi K.
So, it is no secret that you have a fair amount of Bollywood clients, but you're very proud of the fact that you do these corporate workshops, on
That's
lifestyle, holistic wellness, and how well received are they?
Given the feedback, I'd like to think they are very well received.
But is it like a day-long program that you do, and what
So
really
I
goes
have
into
different models. So we do just a 2-hour workshop, or it could be a 2-day workshop. So depending on what is required and what all we include. Sometimes we include everything. I'll have someone come in from a fitness space who will also join me. So it's depending on how holistic it is and how many people there are I'm addressing. But we do a workshop called Wellness at the Workplace.
Wellness at the Workplace? That's interesting. If corporates want to write into you, would you want to give out an email ID, please?
Sure. It's Vishakha, that's Vishakha, Shivdasani, Shivdasani @gmail.com. One word, Vishakha Shivdasani @gmail.com.
Super stuff. Now, vitamins and supplements. I know people, without taking names again, who will take a fistful of vitamins and throw them in, in the morning. Do you approve or not approve? Obviously, given that you're a medical doctor, you would, know the veracity of both.
So I would prescribe vitamins and supplements only and only based on your blood parameters, your blood work, and also based on the medicines that you're taking, because some medicines require you to take vitamins and supplements to kind of negate the side effects of those. Since we're talking about heart, the commonest one would be a statin. Now, for a statin, the commonest side effect is myalgia, which is muscle aches and pains. And most people who take statins, it's so sad because their quality of life deteriorates. They come and they say, we're feeling giddy, we're feeling dizzy, we have muscle aches and pains, our muscles don't recover post-workouts. And all you need to do more often than not is just add a vitamin called a coenzyme Q. So in the West, it's actually a co-prescription. With a statin, you must give a CoQ because that provides energy at the fundamental level of your cell, of the mitochondrial cell, which is the fundamental source of energy. So you just need to do that. And the patient comes back in 2 weeks saying, I suddenly feel so better. Why wasn't this prescribed to me earlier? I have no more muscle aches and pains. I have no myalgias. I'm sleeping so much better. And that's all that it takes, just a co-prescription. Similarly, for people who, take other medicines or vitamins, who have hypertension, we need to check their electrolytes, their sodium, potassium, maybe give them some magnesium to help them sleep well at night. It's so much better than taking a sleeping pill. So you just take a magnesium with a low dose vitamin D at night and you sleep so much better. You wake up feeling rested. So I like to prescribe even an omega-3 to up the good cholesterol.
I'm going to end this discussion on the importance of lowering stress levels and the importance of sleep for good heart health. Dr. V.
I think sleep is actually the most undervalued health parameter for heart health. When you don't sleep well, it's not the number of hours. It's the quality of your sleep. And when you don't have a good quality sleep, I'll ask my patients, do you wake up feeling rested? So it doesn't matter if you sleep 8 hours, you can sleep 5 hours, but if the answer to that is no, that is not good quality sleep. You need to have a good quality deep sleep. So you have people like Narendra Modi, Mr. Narendra Modi, who, everybody knows sleeps only for 4 hours. And he's so active. And, I'm guessing his health parameters are fantastic and his heart is great. I'm sure his quality of sleep is very good. So don't focus on the number of hours, but the quality of your sleep and how well you feel when you wake up the next morning. If you don't sleep well, it affects all your hormones. Your testosterone level goes low, your cortisol level goes high, and honestly, if you have one hormonal fluctuation, then leads to a cascade of multiple hormonal fluctuations. The same goes with stress. When you're stressed, your sympathetic nervous system goes in overdrive, and you have an elevated cortisol. Now, elevated cortisol is good for us to be motivated in life, to have some amount of ambition, but to have it in a state of constant stress where your cortisol levels just don't come down and they're just constantly elevated. Now that's a problem. That means your sympathetic nervous drive is on overdrive 24/7, and that causes again a lot of hormonal fluctuations. Your insulin levels go up, your DHEA, which is a hormone which helps with immunity. That goes down. So, you need to do what it takes, whether it is meditation or pranayam, whatever it takes to make sure there is a sync between your sympathetic and your parasympathetic.
Dr. V, it was an absolute pleasure having you on the show. You take care of yourself. And,
Thank you.
Have a wonderful day ahead. Cheers.
Thank you so much for having me.
Follow her on Insta, Dr. V. Yeah? We're going to do some messages and come back. Don't go anywhere. It's 14 minutes past 11 a.m. live. I'm Hrishi K.